York State announcing today new guidelines for who is going to be eligible now for the COVID-19 vaccine, and also what the state is going to be doing with extra doses that are not being used by hospitals. Governor Cuomo says that New Yorkers who are immunocompromised can begin getting vaccinated now, regardless of your age. That's going to start on the 15th of this month. Now, this includes cancer survivors and people with cancer, heart disease, diabetes, and people with Down syndrome. Also, the state is going to send any unused doses set aside for hospital workers to local health departments to vaccinate other people. 94% of people who die from COVID have at least one pre-existing condition. We've also learned from Erie County today that at least 9% of all county residents have now received at least one dose of the vaccine. 3% have received both of the doses. 32 more people have died from COVID in Erie County. We also learned today a case of the contagious UK strain of this infection has been found in Allegheny County. The health department says it was found in a student who traveled there from another part of the state.
The New York State prison system is beginning the process of vaccinating inmates. Prisons will use the same guidance as the public, but the move is already drawing some criticism. 7 Eyewitness News reporter Hannah Bueller takes an in-depth look tonight.
We are vaccinating people in prisons on the same basis that we're vaccinating people in the general public.
Starting Friday, the state of New York is now vaccinating inmates 65 and older in the New York State prison system. According to the Department of Corrections, there are 1,075 people who are in the system who are 65 and older, and DOCCS is in the process of preparing to vaccinate that population, consistent with statewide guidance for that age group. The announcement comes as vaccine supply across the state is extremely limited.
I think that this is more about politics than it is about science.
Republican State Senator Robert Ort says he believes the prioritizing of inmates when there is not enough vaccine for law-abiding citizens who are eligible goes too far.
Ahead of other New Yorkers who are not in jail, who have not broken the law.
But Republican Erie County Sheriff Tim Howard is in favor of it. In this letter released to Governor Cuomo 2 months ago, Sheriff Howard details the need to vaccinate inmates and staff. He said the confined spaces of jails can quicken the transmission of the virus among inmates and staff.
They're as vulnerable as we are, so I understand why they would want to vaccinate the inmate population.
Mark Priori is the president of the CSEA Erie Corrections Unit, which represents corrections officers who work at the Erie County Jail in Alden. He agrees inmates should be vaccinated, but his main concern is prioritizing who gets the vaccine and when.
We've had 10 vaccinations so far.
10 doses of the vaccine to cover more than 210 corrections officers in Alden. The group was eligible for the vaccine as part of 1B, but Priori says other Erie County workers have received the vaccine before his frontline workers.
All of which are not in the same confined area that myself and my members are in, as well as the inmates.
The Erie County Department of Health says it has been administering vaccine to eligible Erie County employees, including those eligible in the sheriff's office, from our limited allotment each week, and we will continue to do so. Priori says since the start of the pandemic, 45 officers and 60 inmates have tested positive for COVID-19, and it's the officers who are bringing it into the facility.
I can't begin to understand how we have fallen through the cracks.
Hannah Bueller, 7 Eyewitness News.
Now to that